Hello, good afternoon, everyone. I'm Julie Alonso-Katzowitz. I am a child psychiatrist, also trained in pediatrics, and I'm going to be talking to you today about adverse childhood experiences, the ACES study, and some of the data that came out of that. So how many of you have heard of the ACES study? Excellent, vast majority of people. And now I'm talking to a group of mostly pediatric people, so I'm happy to say that you guys are all aware of it. I attended the American Academy of Pediatrics conference several years back, and the theme was actually toxic stress. So they've really been putting an emphasis on that in the past several years, trying to get the word out about these kinds of studies as well as what we can do after we analyze that data. So the ACES study was a retrospective study, the largest of its kind, to examine the health and social effects of adverse childhood experiences over the lifespan. So basically they surveyed people, these were all adults between the ages of 18 all the way up into their 90s, and sent all the participants in the Kaiser Permanente health plan that agreed to be in the study a survey asking them about various kinds of childhood experiences that they had, and I'll go through a little bit more of that later. But they had a very large return, 18,000 participants, and were able to analyze that data. And the first paper out of the ACES study came out in about 1998. Since then, there have been dozens, if not close to 100 or more studies that have come out analyzing that data or spin-offs of that data or looking at additional questions that they may not have asked about in the first study. As you see, it was a collaboration between the CDC and Kaiser. And the conclusion they really came to was that the ACEs were common, I think more common than people thought, that they're highly interrelated and that they build upon each other. So if you're exposed to more than one adverse childhood experience, the effects are additive and almost like exponentially additive in many of the circumstances that they looked at. So these can lead to problems throughout the lifespan, including mental health problems, physical health problems, and other quality of life indicators that are impaired. As I mentioned a little bit, what do we mean by adverse childhood experiences? So these are things that represent both medical and social problems that we see commonly in treatment. So kids who are abused, and they looked at physical abuse, sexual abuse, emotional abuse, neglect. They looked at both physical neglect and emotional neglect. So nutritionally versus if someone was not getting giving attention to their child. Exposure to domestic violence within the household, substance abuse within the caretakers or parents, severe mental illness in the caretakers or parents, loss of a parent, parents who were involved in the criminal justice system. So these were the initial factors that they looked at. And then in the initial survey, they had sub-questions for each of these categories. So they would say something like, have you ever experienced exposure to violence in your household, et cetera? And that's how they collected the data initially. And what they saw is that these adverse experiences, particularly in that critical early development, 0 to 3 and early childhood period, can really actually impact the development of children's brains in an unhealthy way, as well as other physiologic effects, mostly things like endocrine effects that may lead to illnesses in adulthood. And so what they found, as I already alluded to, ACEs are common. Nearly 2/3 of adults in the survey had at least one. And I also wanted to mention too that you're talking about retrospective, and when you're looking at people who were with such a broad age range, you have to think back that some of these things may have been more normalized for a 90-year-old when they were being raised versus someone who's 18. So you have to take that within the context of their era and when they were being raised, but they were still answering to the best of their ability, hopefully, and to the best of their memory, which is another limitation when you're looking at such a wide age range of participants. But the ACEs often don't occur alone. If you have one, there's a very high chance that you've had more than one. I think we would agree with that from what we see in practice. The more ACEs you have, as I said, the greater the risk exponentially of some of these adverse health determinants and effects. And it's irregardless of which specific ACEs you encountered. So whether you were abused or neglected or had exposure to violence, they all had some correlation with a lot of these adverse outcomes in adulthood. Not necessarily were they exactly identical, but they still had correlations. And they looked at diseases like things that we would see commonly: cancer, heart disease, mental illness, the perpetuation of violence in subsequent generations, and being a victim of violence. And I'll talk a little more specifically about some other things that they looked at as well. And once you see these kinds of effects, we know that that correlates with things that impair productivity as an adult as well. So being absent at work, driving up healthcare costs. People who've experienced more ACEs tend to utilize emergency care and healthcare more. So that costs more to the system. Mental health problems, and then they may be more likely to be impacted with the criminal justice system themselves. So this is a schematic that they looked at, or that they came up with outside, I guess, out of the data. So you look at the bottom of the pyramid, you have children who are exposed to adverse childhood experiences, all the things that we talked about. And then a large portion of them will have some effects on their neurodevelopment and physiologic development. As you go up into more probably middle to late childhood, you may see, even at that time, social, emotional, cognitive effects, how the child's functioning at school, social relationships, etc. And then usually by adolescence, you may see adoption of high-risk health behaviors, things like using substances, high-risk sexual activity, other impulsive or reckless behaviors. And then as you enter adulthood, you might see a portion of those people going on to develop these chronic diseases, disabilities, and social problems, and then potentially earlier mortality. So definitely increased morbidity, and then possibly earlier mortality. And I think this highlights too that not everyone who experiences these is going to have all of these effects, and we still don't exactly know what all of the factors are regarding resilience and how people process through trauma. But a fair portion, as you go up the pyramid, are going to have these kinds of effects from their early childhood experiences. And this is a schematic of just showing again what kind of categories they were looking at. So abuse, I mentioned physical and emotional neglect, and then measures of household dysfunction. So in subsequent studies, they added other things like bullying, violence, exposure from siblings. There were a lot of other behaviors or exposures that they added that they were looking at potentially, but initially they narrowed it to these, which were probably the most easily identifiable and common. And again, looking at the data, about almost 2/3 of people had experienced at least one adverse childhood experience. Within that, about a quarter of that 2/3 experienced just one, but the rest of them, that's a quarter of the total, but the rest of that 64% experienced 2, 3, or even 4. So almost 15% had 4 or more ACEs. So, and remember that the effects are additive, and some of the disease states they saw were exponentially higher risk if you'd had multiple ACEs. The more you had, the more risk you were for developing some of these conditions or some of these unhealthy behaviors. As far as what they saw most commonly, as far as abuse, sexual abuse was more common in the survey participants, and as far as the household dysfunction subcategory, having a relative or caretaker who was a substance abuser in the household was the most common. So over a quarter of people said they had experienced that, followed by having someone with a mental illness, almost 20%. So pretty substantial numbers that we're seeing. And some of the health risks that they looked at subsequently that someone might develop after being exposed to ACEs are things like substance use disorders, so alcoholism, illicit drug use, nicotine use, early initiation of smoking, early initiation of substance use, so earlier in adolescence maybe than typical. Chronic medical conditions, they looked at things like cancer, diabetes, pulmonary issues, heart disease, liver disease. So these are all the big categories that you see in adult chronic illness. Mental health disorders, not exclusive, but depression and suicidality were two of the common things that might be correlated with ACEs. And then behavior and quality of life indicators. So prenatal health, impaired, just general health-related quality of life. When they asked people who'd experienced the ACEs, how do you feel in general about your health? They tended to rate their own perception of their health lower. They were more likely to be involved in intimate partner violence themselves. They were more likely to have early initiation of sexual activity and more likely to see adolescent pregnancy. They may have also been more likely to have exposure to sexually transmitted infections and high-risk sexual behaviors. And this kind of reminds me of a Rorschach, but you can see some of the top 10 health risks or concerns in the US. And then on top of that is superimposed, what percentage of people might have been exposed to ACEs. And so you can see some of these can have a high overlap or high correlation with some mental health disorders, with high-risk sexual behaviors, and they have on there like general life dissatisfaction, hopelessness. So it's not just disease states, but just your general well-being as well. Not to get too much into this because I think this is a whole other topic, but when we think about the neurobiology of trauma and stress, what we're looking at here really is toxic stress, not any stress, because as humans, we all undergo stress on a daily basis, and stress is in fact adaptive in many ways. If we didn't get stressed before we study for our board exam, for instance, we wouldn't be as motivated or as focused. So a little bit of anxiety and stress can help us to adapt or to achieve our goals, and that is a healthy response. Tolerable stress would be things where, the loss of someone close to you, divorce, things that are stressful, but you can rebound from them with appropriate supports, and they're normal things that we experience in life. And so with good support and a good environment, we can recover from these stresses and not have long-lasting elevated stress levels. Toxic stress is when you're seeing these elevated stressors over either a very severe but acute period or a just prolonged period of time. So you're just going into like an overdrive stress state chronically. So you're producing more cortisol. In general, you're more hypervigilant, you're more on edge, and feeling just more tense and anxious and stressed. And that's what we're talking about here with the ACEs, is just this prolonged activation of the body's stress response, like that sympathetic overdrive is how I think of it. And that's what leads to a lot of these adverse health consequences in adulthood. In general, this can have far-reaching effects. So toxic stress can affect nutritional state, it can affect growth, appetite changes, things that are really important in children, and can lead to, even as early as adolescence, increased rates of obesity and related comorbidities. It can lead to sleep disruption, to general psychosomatic complaints, which is something I see a lot of. People who have frequent headaches, chronic abdominal pain without a physiologic cause, or other just non-specific aches and pains, and that ties in with that general quality of life indicator. Developmentally, so kids who undergo stressful, traumatic situations can have developmental delays or regression in some of their milestones or behaviors. You can see things like school avoidance, truancy, lower graduation rates, academic underachievement, and inattention, hyperactivity, just that lack of focus, because if you're always on a high alert state, it's hard to focus and to dampen down that stress response. You may also see things like social withdrawal, isolation, things like that, and maybe decreased quality of relationships. Some other factors, so mental health, we see more depressive symptoms, anxiety, and as I mentioned, which is tied into PTSD, this sense of like hypervigilance, hyperarousability, feeling like you're just always on that high alert. Emotional lability, so these externalizing symptoms, behavioral outbursts, irritability, mood swings, things that are often seen in a child psychiatric hospital setting, but are often really tied to early trauma rather than just the mental illness. There's also often a traumatic component where a lot of these behaviors are manifesting from the past experiences of the child. And I had mentioned risk-taking behaviors, smoking, alcohol, drugs, high-risk sexual activity, and then preventable injuries. So just people who tend to be more impulsive, maybe get into accidents more because of those impulsive acts. So this is kind of an extreme example, but this is taken from a Romanian orphanage case of a child who was severely deprived and neglected. And you can see that in this PET scan that some of the areas versus the healthy control, which is the one closer to me, there's underdevelopment of areas such as the temporal lobes, which regulate emotions and memory and important functions that we need to develop as adults. And so you can see, in fact, some of these impaired neurodevelopmental changes on functional scans. And as I mentioned, the recovery environment is important, or also resiliency factors, but in the absence of these kinds of protective factors, which could be both social and genetic, toxic stress can interfere with the healthy development of a child's brain. So there are several brain areas where you can see some changes, or at least theorize that there might be effects from toxic stress in childhood. So looking at your fight or flight response, your executive functioning, which is incredibly important as we enter adulthood, being able to coordinate information, to future plan, to appreciate long-term consequences. I mean, those are all really important functions of being a healthy adult. And then your memory, emotional memories tend to stick more. If you have something that's very traumatic, it can be harder to process through that memory. Those are the ones that tend to have more staying power just because of that emotional component that's tied to the memory. And then also the reward system, that probably ties into development of things like addiction or overeating or other unhealthy behaviors.
Learning to deal with stress is an important part of healthy development. When experiencing stress, the stress response system is activated. The body and brain go on alert. There's an adrenaline rush, increased heart rate, and an increase in stress hormone levels. When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to act as a buffer against the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious, lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, the neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
The chronic toxic stress, living in this high alert, high overdrive state for months or even years, can cause damage to our bodies and can affect things like the heart, circulatory system, high blood pressure, cause ischemic heart disease. There are a lot of metabolic and endocrine effects, and I think this ties in with the hypercortisol state, but things like diabetes, hyperlipidemia, thyroid dysfunction, obesity is a big one. And then other things that might tie in with having like a chronic inflammatory state, so osteoporosis or osteoarthritis, GI diseases, and then possibly even decreased immune response to infection. So really can have multiple different physiologic systems that are affected. Since the study came out now over 20 years ago, they've developed some screening tools that can be used in primary care or in other settings where you can screen someone coming in even for a well visit and ask some similar questions like these 10 factors, have you experienced any of these, and come up with what's called an ACE score. And it's very simple, it's not weighted, so it's either yes or no, and you get a point for each one that someone says yes for. And that can be used in a primary care setting or social work setting or other settings where you're doing screening of populations to stratify people who might need more services or to just look at general risk factors. Now, it doesn't mean that they necessarily need to be referred on for services at that time if they're functioning well, but it does open the door. It's an easy way to open the door for discussion about some difficult topics, and also to present maybe some of this data and encourage people to seek treatment if they're struggling with anything early on to try to prevent some of the later effects. The healthcare system is just a natural place to implement these. There are some ACE scores or ACE testing tools that can be used by psychologists that are more extensive, where they look at different factors. But this is really talking about a very simple one where you can screen someone very quickly and then have a brief discussion and intervention. And then this is a little outside of the scope of this talk, but then taking a trauma-informed care approach to treatment. So that could be a whole other topic in the future, but what do you do once you've found that someone is high risk, or how do you support them better or interpret some of the symptoms or behaviors they're showing within the context of that trauma that they've experienced previously? This is just an example of one of the ACE screenings. I know it's a little hard to see, but if you look online there, it's pretty easy to find an example, and there's a couple of websites that I can recommend at the end. As far as, I think this is not meant to be all doom and gloom, like if you experienced one of these or more of these as a child, you're going to have these effects. We know that there are a lot of factors that play into resiliency, and why does one person who is exposed to a severe trauma develop PTSD or mental illness or all the chronic diseases of adulthood, and other people don't? There are definitely genetic factors, and I think that's an area that's in progress with research right now and will be something that's more coming. And then what are the psychosocial factors, like quality of access of therapy that person got after the trauma? What kind of social supports might they have had? Was there further disruption in their social environment after the trauma? So I think all of those factors play into what we're calling resiliency these days, but it's something where there's going to need to be more research and more, I think, interventions that come out of that. And so we can look at this as kind of today's model of, we're looking at some of these as very isolated silos of like mental illness, substance abuse, violence, and are we recognizing these things and how they tie in with all these other factors, with the early adverse experiences, with the chronic health concerns that may come from the adoption of high-risk behaviors in adolescence and early adulthood. And I think in the future, there's potential to have more of a preventative effort, hopefully, with more education, things like parenting support, parenting education, so that children in future generations don't encounter these adverse experiences, or at least are buffered from their effects. There's also a recognition component, which is where primary care is coming in a lot with screening and trying to identify some of these risks earlier on, and then taking new directions with how do we then prevent and then prevent these adverse experiences, but also treat people who've been through them earlier on to try to ward off a lot of these long-term effects. And so this just begs for why routine screening is very important for trauma. I hope I've convinced you that there are a lot of downstream effects and long-lasting effects of being in a toxic stress state, especially early in childhood when your brain and body are developing critical areas. So in summary, ACEs are a very significant contributor to health risk behaviors, to early mortality, morbidity, disability, and healthcare costs in adulthood. And I think I'm preaching to the choir, but I think this is something where adult healthcare providers are also starting to be more aware of, and hopefully, because this is actually going up that pyramid to them, something that's really important for them to be aware of too, for more like tertiary interventions, maybe not necessarily as much with the earlier on interventions. But I think the findings from the ACE study provide remarkable insight into a lot of factors that people had been observing in a healthcare setting for a long time, and help us to understand how negative experiences can affect psychological, social, and physiologic development. And hopefully with that information, we can work next on more preventative efforts. There are some programs like nurse-family partnerships where a nurse is kind of partnered or teamed up with a mother who's pregnant and follows them through the pregnancy and early childhood, even up to the first 2 years of life, and can help support the mom, help teach her healthy ways to support the child's development, to maybe minimize some of these toxic stresses, teach her healthy ways of positive reinforcement and discipline and things like that to enact with the child. And there are other evidence-based models of those kind of community supports or interventions, which are more of a preventative model. And I think the awareness, I'm happy to see that this has, I think, become more talked about in the past 5 years or so. And that was actually the final video I was going to show you. Has anyone seen the documentary Resilience? No? Okay, so it's Nadine Burke-Harris is the pediatrician who brought a lot of the ACE data to light, and I think really made it more of a talking point in pediatrics. And so she made a documentary with some other collaborators in 2016. And if you haven't seen it, I would highly recommend it, because it's all about the ACEs and how she was observing this in her clinical practice, and then how she delved more into it and really came to have a better understanding. And I think she's become an advocate for making a lot more awareness among healthcare providers about the ACEs, and there have been more CME events I've noticed in the past several years about trauma-informed care and acute stress states. And so I think that's positive, hopefully will lead to more prevention and treatment efforts in the future. So a couple of things very quickly about intervention, because that could, as I said, be a whole other topic. I mentioned routine screening for patients, especially in a primary setting, can be pretty easily implemented and can really destigmatize and open the door to talk about some of these difficult topics. And then an easy way to kind of open the conversation is say, how has this affected you? To get a perspective of what that person thinks, not necessarily to impose what you think or how you think it has affected them. And there, I know in a primary care setting, it's really hard to do interventions because people are so time limited, but referring on, there are evidence-based treatment models for processing trauma for both for children and for adults. So TFCBT, or trauma-focused cognitive behavioral therapy, is the one that's geared towards children and teenagers, and then CPT, cognitive processing therapy, is another model that's geared towards adults. And these are both discrete, time-limited, and very focused types of therapy. They're usually between 12 to 16 weeks, so it's not a huge amount of time, but really focused on allowing someone to create a narrative about their trauma, process through some of the after effects, and take back some of the control of the effects that it's had on them, rather than letting it impair them so much. Things like mindfulness, general indicators of good health, getting good exercise, good sleep, good nutrition, and having healthy social interactions and social supports is really important for people who've been through toxic stress or abuse situations. And then just to highlight once again, I think prevention efforts, doing more population-based interventions of education and support for parents and families in early childhood is key to hopefully having long-lasting impact going forward for future generations.
We all like to think of childhood as this time of joy and innocence. But, for many of us, it's just not true.
When you grow up in these type of situations, it's not something you talk about. I know I didn't.
The first thing that we found is that adverse childhood experiences are common.
Kids are young, they don't know what's going on, they won't remember anyway. Well, the child may not remember, but the body remembers.
There was this incredible gee whiz effect. You mean adverse childhood experiences cause heart disease and lung disease and liver and cancer?
Exposure to trauma affects children's developing brains. The impact is on your behavior, it's on your heart, it's on your DNA. Like, how do you deal with all that?
I don't reach out because I'm not used to that.
We have a whole new body of knowledge now that could open up what we have up till now been seen as intractable, unsolvable problems.
No child should be punched or kicked. No child should be punched or kicked.
If you can get the science into the hands of the general population, they will invent very wise actions.
Do you feel like any of the interventions have been making a difference?
They made all the difference in the world.
It's there, it's possible, and a defeatist attitude is completely disconnected from what 21st century science is telling us. And we should be going after that like a bear.